Well, buenas noches a todos. Good morning, good afternoon, or good night to everybody. Today we're gonna have a live in English. Vamos a tener un live en inglés hoy y el live básicamente es sobre cuando quiero hacer un procedimiento de cirugía plástica estética fuera de mi ciudad de origen. And today's live will be about what tips to know when I'm planning on having a plastic surgery procedure outside of my hometown. Entonces vamos a ir entre inglés y español, pero mainly in English, pero obviamente más en inglés. So, the first thing we need to know when we want to have a aesthetic plastic surgery procedure outside of my hometown would be, think on how to minimize risks. Every procedure that we do, we need to think as a patient, how can I minimize my risks? Many times, we just leave that to the surgeon, and that's not right, because I'm the one that's having the procedure done. So if I want to have this procedure outside of my hometown, I really need to search who this doctor is, right? I need to know that this doctor has the knowledge, has the experience, and of course has knowledge, experience, and so to do the procedure that he says or he or she says that it's going to do. So it's not enough that they tell us that, okay, I am best. No, just go ahead and research how much he or she studied, where did they study, and if they are eligible to do the procedure in that country. Very important. For example, for those things, the national societies are a good idea, or the International Society for Aesthetic Plastic Surgery. You can also search there to see if the doctor is part of the International Society, where I'm the president, and that can serve you as a filter to make sure that that person that will do the procedure has the right conditions for performing the procedure. It's very important to know also that many times the national societies, the National Plastic Surgery Society of each country can, let's say they are on group that have all the plastic surgeons in that country, but that doesn't mean that a person that is not part of that society is not a plastic surgeon. So you have to double check, for example, with the regulatory entities to make sure that they are plastic surgeons. Usually, if they are part of the National Society, they are plastic surgeons. But if this doctor is not part of the Plastic Surgery Society, make sure and use research on the regulatory entity if it's a plastic surgeon or not. So again, the national societies can serve as a filter to see that that person do have the conditions for doing the procedure in that country. So again, search if he has the knowledge and el conocimiento, entrenamiento y experiencia. So the knowledge, the training, and the experience to do the procedure he says or she says it's gonna be done. Also, it's very important to prepare yourself. So now you know that there's this surgeon there that you want to have the procedure with. Also, where is the procedure gonna be? Where the procedure is gonna be done. So make sure that the surgery center has the regulatory permissions to have the procedure that is gonna be done on you. So for example, in Colombia, it'll have like a little star that usually has to be visible at some place in the surgery center where it says that that surgeries can be done there. Specifically, that plastic surgeries can be done there, okay? And of course, those are two main things. And the third things will be you. How are you prepared to have the procedure done? And here, it's a lot of things that you can help. So the first two is you searching that the facility has all the right conditions so that the procedure is done under safety conditions. And second, that the surgeon has all the credentials to do the procedure. And the third one will be about you. What does that mean? That you are prepared for having the procedure outside of your country. So make sure that you have an insurance in case anything happens in that foreign country. For example, in my country, in Colombia, we have this special insurance for cosmetic or aesthetic procedures. Now they're more popular in the rest of the world. Before, they were not so popular. For example, myself, I will not do a procedure on a patient if she doesn't have that extra aesthetic plastic surgery insurance. Don't worry, when you come to Colombia, for example, into my practice, if you book the surgery, you will be booked also in this insurance for aesthetic plastic surgery procedures. In case a complication appears, you are covered. So it's important that you make sure that you have, in case of a complication, an insurance that will cover this complication. Also, of course, it's very important that you know where you're staying, that has the right conditions for you to stay there after the procedure for the recovery. So it's very important that you see a place, a hotel, or some place where you can stay, and when you're having, where people will take good care about you. So many times you can have a nurse that will be in charge of you. Of course, that's extra money. Or some places include the nurse. So it's important for you to search what will be the best recovery place for you. Also, it is important that you know where the doctor's office is, and that ideally you're nearby that office doctor, and also search who's gonna take you there, right? If you have some kind of transportation that will make sure that you get there safely. Also, make sure that the doctor speaks your language, because it will be very difficult to communicate if he or she does not speak her language or your language. So make sure that you will not have any communication problems once you're out of your hometown, okay? And of course, other things that you can do. For example, when you're having the procedure done outside of your hometown, since you're traveling all the way just to have this procedure, make sure that you are in optimal conditions. Meaning, it is a good idea that you can take some blood test before you even fly outside of your country. For example, that you have a good hemoglobin. That will be done with a blood test. Because if you have a low hemoglobin, guess what? You will not be able to have the procedure done until the hemoglobin is above 12. Especially if you're doing a liposuction or a tummy tuck or any big procedure where you're gonna lose some blood during the procedures. So make sure that the best thing you can do for yourself is have a blood test and make sure that the hemoglobin is good. If your hemoglobin is above 12, it's great. And if it's as high as it can be, much better. So for example, if you're having a body contouring procedure, make sure that you do the blood test, see how much is the hemoglobin. And another good idea can be, for example, to take iron pills before the procedure, because those iron pills will help you increase the hemoglobin. More or less, you can take 1 pill a day. And that pill, when you take the pill, the iron pill, is very important that you don't take it with any dairy product or milk or cheese, because if you take milk or cheese and then take the pill, guess what? The iron will not be absorbed by your intestine. So you are just spending money and losing the money, because nothing will happen with your hemoglobin. So it's very important that when you're taking the iron pills, you make sure that you do not take any dairy or ice cream or milk or yogurt or cheese or anything, or cream, nothing of that. For what do you take the iron pills before traveling? For having the hemoglobin as high as you can. Of course, if you have it too high, then it's bad. But usually a woman will have it around 12 or 13. And if you have it in 13, it will be great. If you're doing a body contouring procedure, if it's above 13, it will be great. Because always when we do a liposuction or a tummy tuck, you will lose some blood and you will end up with a lower hemoglobin than the one that you entered the procedure. And if the hemoglobin starts to go low, lower than 8, you can start having, for example, dizziness or headaches, or just a heartbeat, like a tachycardia, like a really elevated heartbeat, and that's not good for you and for your healing process. So that's why, as high as we can have the hemoglobin, the better. And make sure that you have this blood test before coming, so that you have the hemoglobin above 12 and you can have the procedure done. If not, you may fly and then you may not be able to have the procedure. Or worse, you will end up asking for a blood transfusion before the procedure, which is not ideally. That should not be done. Why? Because a blood transfusion, as any procedure that we have, has risks, and you should not do it before the procedure, just to bring the hemoglobin up. Of course, many times after the procedure, you can end up having a blood transfusion, because if you, as I said, lose a lot of blood during the procedure and you end up with anemia and having a lot of symptoms, as I tell you, headaches and heartbeats very high and dizziness and hemoglobin under 8, you will be a candidate maybe for a blood transfusion, okay? Other things that you can check will be, for example, other blood tests that you can check will be, for example, how is your creatinine, your glycemia. Yeah, all of those are good that you check them and make sure that they are under good ranges or normal ranges. Another thing that many times will delay the procedure will be, for example, a urine test. So make sure if you have an infection, a urine infection, you have to delay it so that you can take some antibiotics before having the procedure done. So if you have a blood test and you have a urine test and they are negative, the urine test, so no infections, and you have a good hemoglobin, no infections also in the blood, you will be great because you travel, and then you know that you can have the procedure done without any problems. Also, another thing will be in planning the procedure that you arrive certain days before this procedure. For example, if your flight is 3 or 3.5, maximum 3 or 3.5 hours, then you can have, for example, if I fly today, I can wait 2 days and then have my procedure done. But if I fly more than 3 or 3.5 hours, like for example, a flight of 5 hours, 4 hours, 6 hours, 7 hours, then it's not wise to have the procedure immediately when you arrive. You should wait more than 2 days, actually more than 3 days, to be able to have a procedure done. Because, why? Because when you fly on a plane, since you are in a high altitude, many times don't you feel that you get swollen, your feet? Of course, and when you swell, right, there's what we call venous stasis, or estasis venoso in Espanol, meaning that the blood flow is slower. And when the blood flow is slower, it's easier to form a thrombus. And guess what? You can form the thrombus in the plane, and then when you're laying down in the surgery table, that thrombus can get out and block your lungs and produce a pulmonary thromboembolism, which is something that we never want to happen. So again, very important that you wait some days before having the procedure done. So if there is a thrombus, that thrombus will be dissolved and will not end up giving you a complication during the procedure. So again, if you fly, ideally, and it's not a long flight, you can have the procedure done after 2 days, upon arrival in the city. And if it's longer flights, more than 3, 4, 5, 6 hours, at least 72 hours before having the procedure done. Also, it's very important to plan ahead, meaning that you know that you have enough time for the recovery. Many times we fly, we have the procedure, and we want to leave immediately. No, the recovery period is very important, that you are next to your doctor. So if you think you don't have the time for the recovery, it's better not to fly. How many days you need for the recovery? It all depends on what surgery you will have. But in average, there will be more or less 15 days. And ideally 21 days when there are a lot of scars or a bigger incision. For example, for a tummy tuck, for a facelift, or for example, for a breast lift. That will be better to have 21 days after the procedure. But if you're doing a breast augmentation, a rhinoplasty, a blepharoplasty, a liposuction, 15 days will be enough. For example, if you're doing a hair transplant, then we were talking about 3 days, because it's a pretty easy procedure done on the local and no incisions, just minimal, millimetric, little bites. If you're doing, for example, a labioplasty, 8 days will be good. If you're doing a vagina rejuvenation, I would prefer 15, but sometimes 10 can be enough. But again, I'm just giving you averages. But the best thing will be to speak to the doctor and make sure that you know how many days he advises you to stay after your procedure. So again, very important, do the checkups so that your body is in good conditions. Have a blood test, see how is your hemoglobin, see how is your urine, that there are no infections. And take some pills. Iron pills will be great so that you have your hemoglobin as high as possible, especially if you're having a body contouring procedure. But in any case, in any procedure to get into surgery, the ideal is that it's above 12. Again, plan ahead where I'm staying, right? That is comfortable for me and that has all the safety requirements that I need for that recovery. That in that place they speak also my language, you know? And of course in the office, in the doctor's office, the doctor itself should speak your language so that you can communicate. That's the minimal thing that you need with your doctor, communication, right? Of course. And other things. How am I gonna move in this new place that I don't know? Who's gonna take me by car, by taxi? What is the best way that I'm just had a surgery, that I'm not in my best conditions, can rely on a good car or a good transportation to take me to the checkups with the doctor. Make sure that ask who will do the checkups. Will I see the doctor again after I have the procedure? Very important, basic questions that we should know about that, so that we know where are we going and if they're gonna take good care of us or not. Important again, how many days I have to stay after the procedure. Make sure and look for that. And of course, that you speak with your doctor before you go. That will be great so that you really know what's gonna happen beforehand and you don't have any surprises in the moment once you have traveled all the way outside of your hometown. Important that if we want the procedure to be as safe as possible, that we always remember the safety, the ISAPS, the International Society of Aesthetic Plastic Surgery Safety Diamond. That consists of 4 pillars. Pillar number 1, that the doctor that is doing the procedure has the knowledge, the training, and the experience to do the procedure itself, to make sure that he or she is board certified in plastic surgery or is eligible to do the plastic surgery procedure in that place where you're traveling. For that, the national societies can serve you well because they filtrate the doctors, meaning that if they are part of the national society, usually they have the experience, the training, and the knowledge to do the procedure. But that doesn't mean that every single doctor of that country has to be a member of that society. Make sure and you know that. Also, there are international societies, as the International Society for Aesthetic Plastic Surgery, ISAPS, where you can double check if the doctor is also a member of the international community or the international society. That's the first pillar. And make sure that he's not only or she's not only the plastic surgeon, but that he or she is the right match to do the procedure that is gonna be done on you. Because some doctors can be a plastic surgeon, but maybe they don't have the experience in doing that particular procedure that you want to have done. The second pillar is where the procedure will take place, that the surgery center has all the safety issues that are intended to be present when you are going to have the procedure done, so that the surgery center has all the regulatory requirements to be opened to have a plastic surgery procedure. The third pillar is you, that you are in ideal conditions, that you are not free of disease to have the procedure done, and for that, do the blood test and some other checkups that must be done before going to the place where the surgery will take place. Here it's important to ask, for example, for extra exams. If you're doing something on your breast and you're above 45, ideally bring your mammogram so that the surgeon can see it. If you're having, for example, a vagina rejuvenation procedure, do a pap smear so that you know that everything is good before arriving on the city. And because many times some extra tests can delay the procedure. And guess what? You want to have the procedure as soon as you can. Remember, If you travel 3 hours, a little bit more than 3, 72 hours after you arrive in the new city, you have to wait to have the procedure. And if it's more than 3, 4, 5 hours, you have to wait at least 72 hours to have the procedure done. All those little things will maximize the time that you stay with the doctor with the surgery already done on you, meaning the recovery period. You need to be as quick as you can to have the surgery so that you leave as much time as possible for the recovery period before you travel back. Okay? Important that you don't take, for example, something as easy as green tea, any vitamins. You should stop them at least 15 days before your surgery. For example, garlic pills, ginkgo biloba, or any kind of medication should not be taken 15 days before your procedure. That's very important, because if you take it, guess what? And you arrive, you will not be able to have the procedure done, and you'll have to wait time, wait time, valuable time in that foreign country or in that foreign city without having anything and any procedure done, just waiting, and you're losing time of your recovery time. That is valuable. Okay. Other things that should be done, of course, no smoking, of course, no alcohol. Okay, no smoking at least 1 month before the procedure, at least, and 1 month after, and alcohol at least 8 days before the procedure, so that you don't have any problems on complications derived from that particular taking of alcohol or smoking. Remember that smoking has two things that increase risks. The first one is that it gives it puts the blood like more sticky or more dense, so it's more prone, that blood, to have a formation of a thrombus and end up with an embolism. And also because that blood is thicker, it can start to block a little bit the really small vessels that usually nurture your skin. So it's easier to have a skin necrosis, or that the skin suffers and a little bit of the skin can die and leave you with a scar. And that is much easier in smokers. So make sure, and you do not smoke at least 1 month before your surgery, so that we can decrease that risks. Remember, there is no surgery free of risk, but you as a patient need to be responsible of your procedure and try to be as safe as possible by following all the doctor's recommendations. So let's see if I have gone over all of them, or some of them are being lost in my mind. I will answer some questions right now for those that have any questions, and maybe some things that are missing light up in my mind when you ask me those questions. So if you have any question, just make sure and ask for it right now so that I can go ahead and answer them. But the most important thing is plan ahead when you're thinking on traveling. When you plan ahead is how many days I have to stay after my procedure, according to what my doctor advised, usually around 15 days, or for other procedures that have more scars, 21 days. Important that I stay as much as I can in the country after my procedure and not waiting for my procedure. That's why if I have some blood tests and make sure that I'm in optimal health, it will be easier to have the procedure quicker. Remember, at least wait 48 hours when I travel 3 hours, and at least wait 72 hours when I travel more than 4 or 5 hours before having the procedure done in this foreign country or in this city away from my hometown. Also, make sure that you understand your doctor and that the doctor understands you, that they speak your language, because communication is vital during and after, before, during, and after your procedure. Make sure that that doctor has the knowledge, training, and experience, and that the place where you will have your follow-ups, the doctor's office, and the surgery center has all the regulatory requirements for that city or for that country. And of course, make sure and ask what is gonna be used in your surgery, what kind of implants, yeah, and what kind of other stuff that is needed for your procedure, so that you know that everything that will be used in you is to reduce risks and is optimal, of good quality. Very important, okay? And of course, where I'm gonna stay. Do they speak my language where I'm staying? Will I understand them? Will they understand me? Who's gonna be taking care of me? Is there a nurse, a professional that know how to take good care of a recovery post-surgical for aesthetic plastic surgery patient? And again, do I need a nurse? And who's gonna move me in the city? How many follow-ups I'm gonna have with this doctor? I am gonna see the doctor after the procedure. All vital questions that you should not be shy of asking when you're traveling outside your hometown. So again, if there are no questions, which I'm seeing there are no questions, I think people are very shy tonight, or maybe it's because we're doing it in English. I just want to go ahead and finish my life today. So I hope for all of you that are thinking on traveling outside of your hometown, these tips will be helpful so that you have the safest procedure as possible. Thank you and good night for everybody.